presentation, I'll go off screen also so we can have more bandwidth for the slides. Okay. Welcome, everyone. My name is Kelly Malone. I'll be your host for today's webinar. And we'd like to thank you for attending the Birthing the Magic collaborative presentation by Christina Cheek on breastfeeding support, what to do when feeding gets difficult. I do want to remind everyone that for doulas, this will qualify for one contact hour, and we'll have information at the end of the meeting for how to get that credit. So I want to, just start off by asking some simple questions, welcoming everyone, and just asking, are you an expected mom? Are you a doula? Are you a partner of an expecting mom? We'd love to know who's in the audience. I know we had a lot of people recognize what city they're from, but we may have some new people who've joined since that started. So if you don't mind, please feel free to put in what city you're from. We've had folks, we're from New York to California, so we're coast to coast today, which is great. The next thing that I wanted to do was just to remind everyone about Birthing the Magic Collaborative. Our goal really is to have healthy, positive outcomes for Black mothers and their babies. So with that, I'm very excited to turn this over to Christina. And I apologize. You can tell I'm nervous. There's so much to say about Christina. She's the founder and executive director of Sister Girl Birth Initiative, which is a community-based nonprofit advancing Black maternal and infant health across Valdosta and rural South Georgia. Christina has more than 16 years of experience, and she is a certified doula, certified lactation counselor, and perinatal mental health certification candidate. I mean, we are in really good hands here, and it's really great to see just the level of qualifications that we as Black women have and are able to share information with each other. Christina's work spans childbirth, education, breastfeeding support, support for fatherhood engagement, reproductive justice, and maternal health advocacy. She is a graduate of the prestigious Morehouse School of Medicine, Center for Maternal Health Equities Perinatal Patient Navigator Program. Christina now serves as the South Georgia Regional Site Coordinator for the Georgia Black Doula Network. She mentors emerging doulas and she partners across the region to strengthen maternal health outcomes through advocacy, workforce development, and community-driven solutions. So with that, I will welcome Christina to take us through what she has to say, and I know it's going to be very powerful and helpful for all of us.
Oh my goodness, Kelly. Thank you so much for that wonderful introduction. Hello, everyone. I'm so happy to see everybody that's on the call and so many motivated and empowered women that are in perinatal health. All of my birth workers, my doulas, my lactation counselors, my expectant and postpartum mamas. I'm so happy to be here and honored that you choose to spend your time with me on this Tuesday afternoon. And my goal is to encourage and help you all navigate the breastfeeding journey and to avoid common pitfalls that are experienced in the prenatal and postpartum period. If you are a birth worker, you work with moms, this is good information that you can take back to them and expand your services that you give to the women and families that you support. And if you are an expectant or postpartum parent, these are things and tools that you can tuck in your pocket so that you can be empowered and have shared decision making in the care of not only yourself, but the health of your baby as well. So let's go ahead and get started. I'm going to try to figure this out. I always get tripped up on sharing my screen. So bear with me. I feel like I can do this. Let's see here. I rehearse this quite often to make sure that I am able to share my screen with y'all. And if anybody has any issues with seeing my screen, please hop in and let me know, because I want to make sure that everybody is getting this information and we're not running into any kind of technical difficulties. So again, the class that the session that we're talking about today is Nourishing Babies, Supporting Mama More Than the Latch. It is commonly said that breastfeeding is much more than just breastfeeding. Breastfeeding is bonding. Breastfeeding is public health. Breastfeeding is safety. Breastfeeding is healing. Breastfeeding is history. Breastfeeding is love. And of course, breastfeeding is nourishment. And that's what I want to bring to you all today, and show you how miraculous and wonderful breastfeeding is. And while it is the biological norm, unfortunately, a lot of our moms get caught up and get derailed from their breastfeeding journey and ultimately give up. And my job today is to give you the tools and the know-how in order to make sure that that does not happen, that all of our mamas are successful, and however that looks for them, to make sure that they're successful on their breastfeeding journey. All right. So again, that's me when I had hair, when I had longer hair. Christina Cheek, founder and executive director of Sister Girl Birth Initiative here in Valdosta, Georgia. Been doing birth work for about 17 years following the birth of my first baby. It was completely and amazingly life-changing for me. And I remember how it was when I was pregnant and I told my family and friends that I wanted to breastfeed, and all the negative things that was told to me, and you know, all the barriers that I knew I faced. And also, to add on top of that, I told them that I wanted to have an unmedicated birth. And if you could see the looks in their faces that they had, and again, just all of the negative vibes and things that were stacked against me, and the fact that I made it. I exclusively breastfed my firstborn, and went on to exclusively breastfeed three more children. And not only did I have an unmedicated birth with my firstborn, I went on to have three more unmedicated births. And I also went on to have three home births and two water births. And it was amazing. And the reason why I got into this work is because of that very thing. All of the negative messaging that I was told, all of the disparities that I faced. Whenever I would share to other women that look like me how positive and amazing my birth story was, when they would share their story with me, a lot of times I did not get that same feedback. They were, there was a lot of trauma. There was a lot of negative support and information that was given to them, things that were not information that was not evidence based. A lot of things were just stacked up against us, and I said there has to be a better way. And so I took that and became a certified lactation counselor. Then moved on to doula support, and then I got into childbirth education. And then eventually I remembered my love of political stuff. And so I then took my love of maternal health and maternal health policy and married the two and became a maternal health advocate. With that, I did end up running for state representative. And one of my platform issues was to improve Black maternal health, especially, but of course, maternal health for all moms across the state. So this is how I got into the work. I'm still in it 17 years later. I am not going to give up. I'm not going to stop the work that I do, because this is the work that made me who I am and defined me as a woman. So I'm happy to be here, and we're going to have fun tonight. Let's see what else. So let's talk about some of these common pitfalls that we face. And oftentimes it starts a lot sooner than we can imagine. All right. Let's talk about the birth itself. One of the ways that we can prevent a lot of the common pitfalls is choosing, whenever possible, as much as we can, either an unmedicated birth and a birth that is intervention free or has minimum intervention. What that means is letting labor begin on its own, having a good support team, having a birth plan, hiring a doula, taking some prenatal and postpartum breastfeeding classes, getting involved with the support group, um, letting your family members in your support group know what your feeding plans are and what your expectations are, having that conversation with the care provider so that nobody is left in the dark and nobody is surprised that, hey, I want to breastfeed my baby exclusively, or however long you want to breastfeed. Everybody's on the same page. um, Evidence shows that um, intervention-free births, such as labor inductions, um, routine use of epidurals, Pitocin inductions, routine separation of mother and baby, all have an adverse effect on a mother's breastfeeding success. When we have a partner that is not supportive of breastfeeding, that can also negatively affect a mother's breastfeeding journey as well. So there are a lot of things that already are stacked against us that if we took some time in preparation to mitigate, increases our chances of being successful. But one of the best things we can do, not only for breastfeeding, but in general, especially for my mocha moms, an unmedicated birth has significantly shown a decreased risk of maternal and infant mortality. The less interventions we have, the better our outcomes. Trust our body, trust our process, and whenever intervention is needed, that's when we take advantage of those interventions that can help things along. But when possible, let the process go as it's supposed to in its biological norm. So, again, like I said, the birth does matter. Too often I hear a lot of moms and people say, oh, well, at least I had a healthy baby. Yeah, you had a healthy baby. That's cool and all, but the birth does matter for so many reasons. When we have moms who have a satisfying birth where she is supported, where she has shared decision making, when she feels empowered, when she is valued, when she's listened to, when she is honored, her chances of being successful at breastfeeding, not only that, but her mental health and her physical health is improved. So what this also looks like for babies is having immediate skin to skin after birth. Let's change the hospital culture where mom, as soon as baby comes out of the womb, we're taking the baby and we're carrying baby over to the warmer. All right. That's not what we want to do. That's not even a biological norm. Human babies are meant to be carried and be close to mama for so many different reasons. Okay. No excessive drying of the baby. We see it all the time. You look at TV shows and all the stuff. And as soon as baby comes out of the womb, we're taking the towel and we're vigorously rubbing baby down and all this stuff. And we're taking baby over to the sink, 2 hours after giving birth. Sometimes not even that long, but immediately after giving birth, and we're washing the baby down. But what we're doing is we're taking the baby's ability to find the breast on their own. When babies are in the womb, okay, and I have my little teaching tools here. Hopefully you can see me. But baby is floating around in amniotic fluid for 9 months, all right? This amniotic fluid has a certain smell. And when babies come right out of the womb, and when babies are placed skin to skin with mama, and I'm gonna move my screen down so I can see myself. When babies are placed skin to skin with mama, our bodies are so miraculous because these little things here, as you can see on my breast model, these little bumps around the areola, which then the areola is the dark area on the nipple, those little bumps are called Montgomery glands. As soon as baby is expelled out of the womb, These little bumps release an oil that smells exactly like the mother's amniotic fluid. This is a way to help baby find the breast by natural instinct. They use their sense of smell, they use their hands. So when we're taking away baby's ability, all of that fluid and liquid that they've been swimming around in, we've then messed up their highway. All their sensory abilities to find the breast on their own has been diminished. Okay. Also, babies are usually born with a really white, cheesy, thick substance called vernix. Vernix is also important because vernix is what keeps their skin from getting pruny and wrinkly for 9 months. It's full of antibodies, and it also helps mom bond with her baby. There's a hormonal exchange of oxytocin when she's kissing and smelling her baby from the vernix and all the amniotic fluid. There's this exchange of hormones flowing like in a circle through mom and baby. That increases the bonding. The oxytocin also helps her prevent mom from having postpartum hemorrhaging. Oxytocin also helps breast milk flow from the breast out to the nipple and into the baby. So the hormonal flow is important as well. And when we're separating mom and baby, and we're doing a lot of these other interventions like eye drops, when we're taking baby straight over to the warmer, and we're looking at the baby's weight and the height and all the things and how much all those things can wait. Okay. Babies are not going to be born. And then if we wait an hour, baby is not just magically going to lose 3 pounds. All right. All of that stuff, provided mom and baby are okay. And if everything is going smoothly, that can wait. All right. So that's one of the things. If you're a doula, if you're any kind of perinatal provider, helping your mom do a birth plan and encouraging them to delay a lot of the routine procedures that are done immediately after birth. Swaddling. All right. Baby is no longer in the womb. All right. When baby was in the womb, babies were nice and tight and snug inside the amniotic sac and the uterus, but baby is out of the womb now. So what we're wanting to do is get baby to realize, hey, I'm not floating in mom's womb anymore. I'm out of the uterus. I need to get out here and explore my new environment, and I need to get to my food source. Guess what? If we have baby swaddled up like a little burrito inside of that little blanket, right? This is going to make it hard for babies to signal that they're hungry. This is also going to make it hard for babies to naturally find and crawl their way to the breast. When we allow baby to rest on the mom's chest or even on her stomach, wherever they put the baby immediately after birth, babies will instinctively crawl to the breast on their own. This is why babies have that. When you pick up a newborn, you'll often see them kind of lift their legs up in the air. That is a reflex. Babies also can scoot and move around. And if we leave everything alone, and if we don't rush everything and all the stuff, babies, I promise you, will naturally find their way to the breast and latch on all on their own. The other reason why this matters is because when we are asking the mom, has the baby fed yet? Has the baby latched on yet? Oh, let me look at your latch. Has the baby ate? How many times has the baby ate? And you know that you just only gave birth 30 minutes ago, and you have a nurse, or you have your mother-in-law, or you have your friend asking you, has baby ate yet? Think about what that's doing to your confidence and your mental health. What that's telling you is, oh my goodness, especially if you're a first-time mom, this is telling you that, hey, maybe something is not going right, or maybe I'm not doing this, I'm not doing that. So that repetitive negative messaging is already withering away your confidence. Birth is not a sprint. It is a marathon event, and it's okay to take your time and trust the process. The other thing you can do for my doulas is minimize the distractions in your delivery space. This means we ain't having 15 people up in a room watching you get ready to push this baby out. A watch pot never boils. Okay. So think about how it is when you got all your cousins, your aunts, and your friends, you got your phone ringing. Hey girl, you has your baby yet? When you gonna have your baby? Oh girl, you still at 4 centimeters? What girl, you've been in the hospital since yesterday. Girl, I done been had that baby now. Blah, 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 blah. Again, think about the messaging you're being told. Okay. When you have nurses going in and out of your room. You got this person wanting to check your cervix, that person wanting to check your cervix. You're not familiar with who's going to even be in the delivery room to help to facilitate your birth. All of these things can be really distracting when you are trying to not only give birth to your baby, but also figure out how to finally and breastfeed your baby for the first time. So, this might also look like, contrary to popular belief, telling everybody, hey, I don't want visitors right after I give birth to my baby. I need a moment to figure this all out. All right. This might mean having some hard conversations with some close family members and friends. Hey girl, hey sis, I gotta get this baby out. I gotta make sure we got this breastfeeding thing down. I will call you for you to come over when there is some time. We got plenty of time for that, but right now this is more important. Okay. This is not the time for you to be trying to entertain and make anybody else feel good. You have a big task in your hand, mama. Make sure your baby is fed. Make sure you are recovering well. Doulas, your job is going to be to facilitate a healthy and empowering breastfeeding experience and helping mom learn how to advocate for herself, helping her ask questions, and also working with her care team to make sure that they understand what her breastfeeding journey looks like. My computer's wanting to take forever to to switch slides. Let's try this. All right, here we go. The other thing you might find, especially with a lot of care providers in the hospital, and believe me, I am not anti-hospital. Okay, I'm just telling you how this is and the things that I see in the hospital a lot, and I know a lot of you doulas can probably relate. Hypoglycemia, which is low blood sugar. This is one of the things that the nurses will try their best to prevent. Colostrum, which is mama's very first milk, which is being made starting around 16 weeks of pregnancy, is full of sugar. All right. So the way we're going to prevent hypoglycemia is get that colostrum in baby as soon as possible. So we're going to latch baby onto the boob or immediately postpartum. All right. Hopefully the baby can find a breast on their own. We're going to do the breast crawl. And maybe while they're latching on, what you're going to be able to do on the other side, we're going to practice some hand expression. All right. We're going to get that extra colostrum out, supplement that baby, and top that baby off and chalk them up full of colostrum. Some moms even do prenatal milk extraction to prepare them for when they go to the hospital and have their baby. And what they will do, some mamas will experience leakage and have colostrum where they are able to safely hand express and store that colostrum and take it with them to the hospital. If you don't have that, that is okay too. We could do the hand expression when you get to the hospital. But if you are worried about low blood sugar, if the care providers are looking at baby's blood sugar and they're looking at baby becoming jaundice, what we're going to do is we are going to try to supplement with mama's milk first. All right. Cold stress. We talk about making sure that baby is warm. So you'll see a lot of people swaddling their babies, taking a baby and putting them under the warmer and this, that, and the other. There is no better warmer for baby than mama's chest. All right. So we're going to take that baby skin to skin, hopefully with just a diaper on. We're going to take that baby. We're going to have our bare chest open and we're going to lay that baby right there. And if we need to, keep mama and baby, we're going to put some blankets on top and we just going to love and snuggle on that baby. We're going to keep baby right here at the restaurant. All right. This is right here. 2 boobs, 1 chest, and 2 arms is all your baby needs to stay alive. You can keep your baby alive right here. They don't need to be anywhere else. All right. If mama cannot do skin to skin immediately following birth or whatever, we can get dad. All right. Anybody that is going to be caring for the baby or close to the baby can do skin to skin. We are not going to look at the clock. We are going to watch baby. So this traces back to how formula feeding is done versus breastfeeding. All right. So a lot of times when mothers were formula feeding, pediatricians often told moms feed baby every 2 to 3 hours, X, Y, and Z. With breast milk, because of the way that breast milk is composed, it is made to break down and be readily absorbed a lot faster in baby's system than formula milk is. The reason for that is because of the proteins and the fat in human milk are more bioavailable to baby than formula, which is based on cow's milk. Okay. Two different types of mammals. All right. So human babies are made to be fed early and often. Again, often, around the clock. Okay. The reason for that is, and we'll go over this in later slides, it's because human milk is made in a supply demand feedback loop. So the more milk we are giving baby, the more our body responds by making more milk. All right. We're going to room in with our babies. A lot of hospitals are moving toward eliminating the nursery and keeping mom and baby together in the room. Nipple shields, nipple shields, nipple shields. I see so many moms relying on these nipple shields instead of getting a proper breast assessment, hopefully prenatal, to make sure that there are not any kind of anticipated feeding challenges, and working ahead of time to plan ahead to know what to do if you do have feeding challenges that you may face. So making sure that when you are going into your prenatal visits, making sure they actually do a breast exam. The other thing you're going to be doing, mom and doulas, you're going to be asking these questions. If you have had any type of breast surgery or any piercings, anything that has been altered to the anatomy of your breast, that wants to be communicated to your care team, that including your doula, because that can affect milk supply and what your feeding journey will look like. If you are pumping, some of my moms may not want to put baby to the breast, but they want to express their breast milk. Making sure you have the proper pump flange size. You can get that done prenatally, going to a lactation counselor, and they will measure your nipple and make sure you have the proper pump flange size. And also hiring a doula and creating a birth plan. I promise this is going to get a lot more fun. All right. Again, don't rush the process, y'all. We waited 9 months. There ain't no reason now that the baby's here that we feel like we got to do all these things and get everything right. My first time mamas, my primiparas, I want you to remember, this is your first time breastfeeding. This is also your baby's first time breastfeeding too. All right. Even for my doulas, I know we have probably supported 2,500 mamas, but every single mom is their own person, your own unique experience. So I want you to take every mom and family that you support. Don't take it for granted. Make sure you are vigilant. Make sure you are actively listening and meeting and help to make help that mom meet their feeding journeys. Okay. So let's also talk about the stages of milk production. This is extremely important so that moms have anticipatory guidance on what to expect. I think because breastfeeding is not the biological norm, we still don't see a lot of moms breastfeeding their babies. Most of the time, we see bottle feeding. Our moms probably did not breastfeed us. When we are out and about in public, we don't see a lot of moms breastfeeding. When we are going to our prenatal visits, I'm pretty sure a lot of you can tell me that most of the time your care provider probably didn't talk to you or ask you any questions about breastfeeding or give you any kind of breastfeeding education to let you know that, hey, did you know that at 16 weeks, your body's already producing milk? When you have your baby, Your immediate milk it's going to change. Your milk goes through different stages, which is shown here in this slide. The first milk you're going to have immediately postpartum is called colostrum. Your baby is going to be around from day one, day of birth, up until maybe around day 2 or 3. Your milk is going to be in a colostrum phase. Colostrum is very, very, very thick and sticky, and it comes out in very small amounts. The reason for this is because, one, it's full of sugar. That's going to help prevent that hypoglycemia. Colostrum also acts as a laxative to help get that stool, that meconium out of baby's system. It also acts as baby's first vaccination because it is full of antibodies. This is another reason why we are not wanting to pass baby around the room, okay? We want baby to go straight to mama and stay there, because immediately following that skin to skin, your body is getting that signal saying, hey, you know what? Baby's not in the womb anymore. Baby has its own immune system. We need to get this baby full of antibodies. So within 30 minutes of baby being exposed to any type of pathogen that can possibly sicken your baby, your milk is already being programmed to give those antibodies to your baby through mama's colostrum. So that is why the colostrum period is so important. I want my mamas to remember that it comes out in very, very, very small amounts. We are not looking at copious milk production yet, okay? The reason why this is important is because you'll hear a lot of moms say, well, I don't see anything coming out. How do I know baby's getting the milk? Because when we're putting baby to the boob, of course, we can't see the milk going into baby, right? Like we do when we're bottle feeding baby. This is where trust in the process comes in. This is where that anticipatory guidance comes in. Doulas, you were telling your moms, hey, your colostrum is going to be coming out in very small, concentrated amounts. Here's why it looks like this. Here's how we're going to make sure we're topping that baby off with some hand expression. All right. Here's the purpose of colostrum. Around day 3-ish, 4-ish, 5-ish, you're going to start seeing the milk change a little bit. That's going to be your transitional milk. So it's going to be kind of in between that colostrum. It's going to get a little bit more liquidy and copious. All right. It's going to start flowing a little bit faster. All right. It's going to change color. It's going to start turning more white looking. And what we're wanting to see, here's how we're going to tell if baby is getting enough milk. In the colostrum stage, baby is going to be passing that meconium, that really thick, dark, tarry, super sticky poop, okay? When babies are getting that transitional milk, what we're looking for is the change of the color of their poop. We're wanting to see that dark, sticky meconium get more toward like a greenish yellow. If we're seeing that, that means we're going in the right direction. If a mom is telling me at day 3 to 4 that we're still getting that meconium, that means we need to do some troubleshooting to make sure that milk transfer is happening the way it should, okay? Then around maybe day 4, day 5, and it can be a lot sooner, especially if mom is keeping that baby to the breast often, all right? We're going to start seeing that mature milk. The other way you're going to know that mama's milk has quote unquote come in, and that's a term that I actually don't really like because mama's milk is already in at week 16. But this is what you usually hear when people say mama's milk has come in. All of a sudden, mama done gone from a size B cup to a size triple F WXYZ cup. Boobs are super big, mountainous, okay? They're probably super engorged, full of milk. She wakes up, all of a sudden, her sheets are just soaked. That's when that mature milk is coming. All right. We're sitting there, we're clapping. Oh my gosh, hallelujah. But I want y'all to remember, mamas, your milk has already been there. It's just changing based upon this, the needs of the baby as they grow. All right. You're also going to see those stools go from that greenish, from that dark, that black tar to that yellowish green kind of poop. Then you're going to see it look super mustardy yellow. And a lot of times you'll see what looks like little sesame seeds in it. That's how we're telling that breastfeeding is going well. All right. Let me advance my slide. Okay, here we go. Hold on, y'all. And again, like I said, milk supply feedback loop. One of the biggest things we hear from moms is, how do I know my baby's getting enough milk? I feel like my milk is not enough. I don't think I'm getting enough milk. I feel like I have low milk supply. Low milk supply, along with pain, are probably two of the biggest reasons why moms stop breastfeeding. Here's how we can help prevent that. We're going to be telling mom that, hey, look, the way you make milk is by removing more milk. Because the way this works, our boobs, okay, are full of milk glands and globules and all that stuff. They can only store a certain capacity of milk before there is no more room. All right. So, in order for us to fill the milk ducts back up, we have to get that milk out. Getting that milk out looks like putting the baby to the breast. So baby's drinking this milk, and our bodies are saying, okay, milk's going out. We need to supply more milk. Okay. So again, the more we put baby to the breast, the more we are hand expressing, the more we might be pumping, our bodies are going to respond by making more milk. If we are spacing out feedings, if we are combination feeding, all right, we are telling our bodies to slow down milk production. If we do that too often without regular milk removal and breast stimulation, that can slow down our milk production, thus lowering the milk supply. That's when you run into low milk supply. That's what we don't want. We are wanting to tank baby up, okay? Especially if we are exclusively breastfeeding our babies. It is very hard, if not impossible, to overfeed a breastfed baby because the milk is so quickly broken down and flushing out of their system by either their pee or poop. And babies are telling mama, hey, mama, I need more milk. I need more milk. So we are also going to be looking at cluster feeding. You'll usually see maybe day 2 or 3, all of a sudden it seems like babies want to eat all the time. But you have to remember, this baby just came out of the womb. Baby was being fed via the umbilical cord and a placenta. This baby has never known in its entire life what it was like to be hungry. Now, all of a sudden, baby is earthside, and now baby has to ask to eat. So this is where we are going to see babies wanting to cluster feed. Doulas, we are going to be telling our mom that when babies are nursing around the clock, that is normal. That is your way of making sure that your body is responding with enough milk. That does not mean that your body is not making enough. Too often what we think is, oh my gosh, I fed my baby, I put him down, 2 seconds later, baby's crying again, they're acting like they're hungry. That's okay. That is okay, because the more we are stimulating the breast and removing more milk, our bodies are going to respond by that. Caveat, if we are seeing a baby that is constantly being put to the breast, we are not seeing this baby gain weight. We are not seeing baby's body language look more relaxed after feeding, meaning if baby's fists are still balled up all the time, if baby is crying, if baby is grimacing around, if we are not seeing the stools, okay, if we're not seeing enough pee and poopy diapers, that usually means that there is a sign of bad milk transfer, and that needs to be seen about with skilled help. So, on one hand, baby wanting to eat often is a good sign, but if we see a lot of those warning signs, that means that other intervention is needed. Okay, so let's look at what a good attachment and a poor attachment looks like. Again, one of the biggest reasons why mama stopped breastfeeding is because that latch is not right. And if anybody who has breastfed before, God knows that when baby is not latched on right, and that nipple is getting sucked on and grinded by that little hard palate at the top of your mouth, that will make your toes curl. And that is hard. No mama is going to want to suffer through that. So the way we are going to make sure that baby is latched on to the boob properly is, one, by proper positioning. One of the easiest ways you can do proper positioning is simply letting baby find the boob on their own. And oftentimes, if we lean back in our chair, our hospital bed, or wherever, and if we just lean back and lay baby skin to skin, babies will usually latch on and pull the nipple deep into the back of their soft palate and get to suckling really well. And of course, gravity with baby leaning her head into the breast can easily pull that breast back. Chin is against skin. We're also not dealing with a lot of the positional challenges that we face whenever we're doing cross cradle hold. When we're doing cross cradle, when we're doing football hold, a lot of times we're usually not positioning the baby's head the correct way. Usually that the chest and the legs are facing the wrong way. But when we're holding baby just in a biological nursing position, meaning just holding baby skin to skin, just like this, the positioning is optimal. Okay. If we have mamas who have had a C-section, we got different challenges. So the one thing you are going to want to do is just make sure that baby's body is facing all in the same direction. We're not wanting the hips turned. We're not wanting the head turned this way, because it makes it hard for you to try to latch on and nurse with your head turned the wrong way when your boob is over here. Okay. We are also looking for that ear, shoulder blade, and hip bone to be in a straight line. All right. When baby is attached to the boob, we are wanting to get baby's chin touching more of the breast and baby's head kind of angled away from the breast. The reason for that is because when the chin hits the breast first, baby has to naturally throw their head back, open their mouth wide like they're opening a hamburger. And because of that, they're going to pull more of the nipple far into their mouth, into the soft palate. All right. I want you to encourage your mamas, doulas. And if you are a nursing mama, if you are experiencing any type of nipple pain that does not improve shortly after you latch your baby on, please take your baby off the breast and try and relatch. Do not suffer through nipple pain, okay? Because that can be more detrimental, because you can get nipple damage. And whenever we have nipple damage, oftentimes that means we are taking baby off the breast. Anytime we are taking baby off the breast, that is negatively affecting milk production. Okay, so we're wanting to prevent sore nipples to begin with. And oftentimes sore nipples are due to poor positioning. So I wanted to show you a quick video on what proper positioning and a proper latch looks like. And I hope that I can figure out how to share my sound. Please let me know if y'all can't hear it. Just a very quick video.
What are signs of incorrect latching besides pain? Good question, Jamie, because some women have elastic nipples and it's not always painful when the baby is not right. So I would first go back to basics with the latch. If you are latching, make sure that baby's mouth is nice and wide and deep, getting as much of that areola in the baby's mouth as possible. I tell parents to look at their nipple immediately when the baby comes off the breast, right? So if the baby is not latched on how they should be, the nipple may be pinched, may have a white compression stripe going down the middle of it. It may look like a new tube of lipstick where it's like pinched at the bottom and kind of round at the top. You may notice that there is maybe like some wet scabbing on the nipple. That's not normal. Sometimes your nipple may change colors, right? So the baby may have pinched you so bad you have vasospasms. So if your nipple is normally like a brown color, it may go to like a deep, deep purple and then maybe blanch white and then like red, so it'll go through like a color change based on how bad the baby's latch is. So if it's not painful, but you don't think it's right, check the shape of your nipple. Your nipple goes in a circle. It should come out a circle. It shouldn't be pinched. There should not be a compression stripe. It should be kind of pink. It shouldn't be bright red. It shouldn't have abrasions on there. There should not be scabbing or anything like that. And your nipple should not be changing colors when the baby comes off the breast.
All right, so there you have it, ladies. And if there are any gentlemen on the call, which I hope there are, because I'm hoping that dads are also watching this and getting this information as well. But one of the big signs, like she said, this, you see this nipple, this is nice and round. All right. If baby is coming off the boob, and if we are seeing the nipple look like this, or if we are looking at our nipples and they look like the tip of a lipstick, that means that baby is not latched on well, and they're not pulling the nipple back into the soft palate. So again, you're going to make sure baby is positioned correctly. And if you need to take baby off the breast, you're going to take your pinky. Ooh, don't throw your baby's head back like I did. You're going to take your pinky, and you're just going to basically take and put your pinky in a corner of baby's mouth, just like this, and wiggle it and break the baby's latch. Pull baby off gently and try and latch again. Please, 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 mama. Now drop my boob. Hold on a minute. Just drop my boob. Where did my boob go? Oh my goodness. I lost my boob. Here it is. If your baby is not latched on properly, please, 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 please do not sit through the discomfort. Try again, because again, we are trying to prevent nipple damage. All right. Let's go to the next slide. My computer's being super slow today, y'all. I'm so sorry. All right. So this is why we don't want nipple damage. All right. Stage 1, picture number 1. You can see here, there's a little bit of redness or whatever. Okay. We could probably fix that really easily with simple position changes and just making sure baby is open and wide with a little bit of patience. Okay. We do just little fine tuning. Everything's going to be all right. Number 2 is probably where mom might be saying, you know what? It's getting time. Baby starting to wake up. I can see baby starting to suck their hands and move around. They're getting a little squirmy. I don't want to nurse because I know it's going to hurt. It's not that bad. She could probably deal with the pain. All right. But when we are seeing nipples that look like those on picture 3 and 4, that is excruciating. This also can set mom up for infection, which is also not optimal, because a lot of times when we have skin damage, we are going into the tissue of the nipple. And anytime we have something like that, of course, we're not putting baby on the breast. We're not also pumping either. So that reduces your breast stimulation, which then affects your milk supply negatively, because we want nipple stimulation. We want that oxytocin flow. And most importantly, we want that milk from in the breast going out. All right. And of course, we don't want infection due to a breach in the skin, because anytime you have any type of open skin, that can open you up for any kind of bacteria that can make you sick. So let's go on to the next slide. Now, let's talk about engorgement. And I know you heard me say earlier, when your mature milk comes in, you're going to be super engorged. Your boobs are going to grow just overnight, right? That is normal engorgement, because your milk volume has rapidly increased to meet the demands of your baby. What we are not wanting to see is mom's breast constantly full, rock hard, warm. We are not wanting to see baby not drinking well. We're not wanting to see those diapers not changing color. We're not wanting to see hours going by without pee and poops. Okay. If mom's breasts are constantly full, that usually means something's not right. Okay. When milk is not moving the way it should, there is something in your breast called the feedback inhibitor of letdown. When breast milk is not being removed out of the breast, the storage capacity is going to reach its max. It's going to say, you know what? There ain't no more room to put any more milk. All right. That's what makes your breast feel super full. We are wanting to get to the point where we are transferring that milk to baby well, and that breast is softening. Okay. The other reason why I see mamas getting engorged is moms are usually too busy moving around. That means mama's out of bed, she's entertaining people, she's running to Walmart, she's downstairs trying to cook and do laundry, and she has a baby upstairs she needs to feed. But she's saying, you know what? I can do something. I can do this. I can do this. I'll get to the baby in a few minutes. She's skipping feeding. She's skipping pumping sessions. She's not doing skin to skin. And that will catch up to you and bite you in the tail. Because anybody who has dealt with engorgement knows that it is not fun. All right. Moms who also decide not to breastfeed, or maybe they have started breastfeeding, but maybe they're saying, you know what, this isn't for me, and they just cold turkey stop breastfeeding. That's when we are experiencing engorgement. But we want to make sure that we are keeping mama comfortable, and of course, making sure that baby is being fed and making sure that milk transfer is happening the way it should. If you are engorged, the way you can help that, put the baby to the breast. Move the milk, move the milk, move the milk. So moving the milk, again, looks like putting baby to the breast, pumping, hand expression. If you got to put your boobs under the shower, if you got to soak them in some water, whatever you do to get that milk out, that's what we want to do, because we want that milk to move. If you are super engorged and there is nothing that is working, one method you can do to help that is by doing reverse pressure softening. You're basically just taking the engorged boob. And a lot of times when moms are engorged, they're like, oh my God, I cannot have anything touching me because it hurts that bad. But we are needing to relieve a lot of that pressure to move that fluid and make that skin pliable. Okay. If mom's boobs are super tight, oftentimes there won't even be a nipple for baby to latch onto, because mom's breasts are so full that baby can't even pull that nipple out. So the way we're going to do that is by doing reverse pressure softening. And so taking your finger, and you're just going to be slightly pushing back on the nipple, okay, with your fingertips. Then you could take your fingers, as you see here in the picture, and we're just moving your fingers around the breast. Again, moving that tissue toward your breast wall. And what you'll probably see is, because of that reverse pressure, you'll start probably seeing mom starting to leak. If you have a partner, somebody can put a bowl right there and catch that milk, feed that milk to the baby. Hey, it works, okay? If you have a breast pad, however you need, we're just trying to get that nipple soft, okay? You can use your thumbs. You can use your fingers like this, comme ça, like you see in the picture. Whatever we're needing to do to soften that nipple, to soften that breast, to be able to extract and pull that nipple out to make sure baby latches on properly. The other thing is, if you've had a mom who has been on an epidural for a very long time, or an induction, a lot of times, unfortunately, because of those extra fluids, she is more prone to engorged breasts. So doulas, you are having this in the back of your mind. You're saying, okay, I know that this mom has been on an epidural or been had an induction for this amount of hours. This means I need to go ahead and start having a hand expression and making sure this baby is latched on properly so that we're preventing engorgement. Clogged ducts is another culprit. All right. What you'll usually see is a hard lump in the breast. It might feel like a little pea or just like a little hard area with very localized pain. What we're wanting to do to prevent this is by trying to point the baby's nose toward wherever the pain is. This is when it gets interesting. Sometimes you may have to turn that baby around. Sometimes you may have to dangle over baby. Sometimes you may have to lay sideways. Whatever position you can get in to find out where that nodule is to move that milk, that's what you're going to do. You're going to try to massage that area, maybe some warm compress to try to loosen that up, a lot of massaging. And of course, we're going to try and make sure that we are getting a deep latch, because we want to pull that milk out, and we are wanting to make sure that baby's transfer and getting a good suckle and pause rhythm. And we're going to switch sides, okay? We're going to try to make sure baby's feeding on one breast. And then over here, feeding on the other. So dinner, and the other side is going to be dessert. Okay, that's an easy way to remember. One side is dinner, the other side is dessert. You're going to try to put baby on both sides if possible. And mamas, one of the biggest reasons why we get clogged ducts is because we are doing way too much. Slow down, take care of yourself, stay in the bed, recover, learn how to feed your baby. That is your only job after you have your baby. All right. Mastitis. Dun dun dun. Any of y'all? I don't know how many. I can't see my chat, unfortunately. But mastitis, y'all. Oh my Lord. It is not fun. Believe me, it's not fun. I was very fortunate to never experience it. But God knows I've supported a lot of moms who dealt with mastitis, and they said it was the worst thing that ever happened to them. One of the things you were going to hear mama say is that it feels like all of a sudden they felt like they got hit by a bus. They were doing fine. They were having a good time. And all of a sudden they came down what felt like flu-like symptoms, chills. They got fever. They got body ache. All of a sudden there's a super hot and warm swollen area in their breast. All right. It's super inflamed. It just looks angry. All right. And then they feel like they can't do anything. The area is usually very painful to the touch. What we are going to look out for, especially in our melanated moms, the red and shiny area may not always be very prominent on our skin tone. All right, but if you're having any of these other symptoms, that usually points to mastitis. Also, you're going to be looking for, again, like I said, a fever. So the thing you are going to do, you're going to go to your care provider. They are usually going to give you some antibiotics, and you are going to go home. You are going to put your baby to the breast, even on the breast that is affected. Okay. You can safely nurse your baby through a mastitis infection. And one of the worst things you can do is stop breastfeeding in the middle of mastitis, because that breast milk is going to continue to collect, and it's going to get harder, and it's going to get more painful, and everybody's going to be mad. You're going to be mad, baby going to be mad, the whole world going to be mad. Put that baby to the breast. Keep that milk moving. Finish your antibiotics. Mamas, please don't be tempted to say, oh my gosh, I took the clindamycin, whatever they gave me, I feel fine. And all of a sudden you stop, and then next thing you know, the infection done came back. Finish your dose of antibiotics. Please, please, please finish your course of care. Okay. Trying to move this along, y'all. I can be long-winded. So the new mastitis protocol, what you're going to do is you're going to nurse your baby as your baby is demanding to be fed. Instead of hot compress. In the past, mastitis was treated by telling mamas to go home and put something warm on the affected area. But we now know that anytime there's inflammation, the worst thing you can do is treat inflammation by putting heat on it. What you're wanting to do is now put cold, because cold restricts those blood vessels and helps isolate that infection in one area. Okay. So you're going to take a cold pack or whatever you have in your refrigerator, a bag of peas. If you have a cold pack or whatever you need to do, put some cold on that area. You're going to take your ibuprofen and your antibiotics. You can hand express if you feel up to it. You can also gently massage your breast. And some people take probiotics to lessen the effects of the antibiotics, which can, especially if you are a mama that is prone to yeast infections because your gut flora is thrown off. One good way to prevent that on the back end is by taking a probiotic to prevent those side effects. Another sign of taking any type of antibiotic is thrush. When the gut flora has been thrown off, sugar levels are super high, and you have all these bacteria and all these things, you can have an overgrowth of thrush. What you are going to see is when baby opens their mouth, you're going to see white patches in their mouth. A lot of times they may be very fussy at the breast because their mouth may be a little tender. You might have very sharp pain, stabbing pain in your breast when you're feeding. Sometimes your nipples can be itchy and scaly and red. You're wanting to go to your care provider and have them examine you for signs of thrush. And you are going to want to make sure that the doctor is treating both mama and baby at the same time. Because if not, the infection will go around in a circle and it's going to be a pain in the butt. Okay. So you're looking for treatment of mom and baby simultaneously. And if you, again, on any type of antibiotic, you can ask your care provider to prescribe you a probiotic or something like diflucan to make sure that you are not being thrown off by yeast infection. All right. If your baby is in the NICU, unfortunately, when we are talking specifically to Black mamas and Black infants, too often we experience premature birth at a disproportionate rate. Okay. So this is something that we just need to be prepared for and know how to manage this if your baby is in the NICU. All right. One of the worst things we can do, if I can advance my slide, y'all, I'm sorry. One of the worst things we can do is if our baby is in the NICU, start feeding them formula. All right. There are cases where formula is warranted, but human milk for human babies is always the gold standard. Human breast milk is tailored and specifically made for babies that are born prematurely. Our bodies are very smart, and your milk will be custom made for that baby who is here a little earlier versus that baby who is full term. Okay, so if you find yourself in a hospital, your baby's born early, this is where you're having that conversation with your care provider saying, hey, I want to provide my milk for my baby. I need you to give me a breast pump, have lactation come in and help me learn how to latch my baby on. If baby is able to still nurse at the breast, if they are premature, or making sure that you have a care provider that can help you establish a healthy pumping and hand expression routine. And if you don't have any access to either one of those, all right, access to human donor milk. So again, one of the reasons why formula is often risky for babies that are born prematurely is because of a condition that's called necrotizing enterocolitis, which is where babies who are usually born very prematurely, because of the way that the proteins in cow's milk, which is what formula is based on, can create micro tears in the infant's gut, okay, which is then leaving baby's intestines vulnerable. When that happens, that makes baby's intestines no longer sterile and susceptible to any type of infection. That infection can look like this. And I should warn you of what this looks like. This is very, very, very scary. And unfortunately, a lot of Black infants suffer from this condition. As you can see on the picture in the very far left, that's babies' intestines that are severely infected by bacteria or viruses. And human milk can prevent a lot of that. Okay. We are usually seeing babies with very swollen abdomens because everything is just thrown off. And we all know, again, breast milk has healing powers because it is full of antibodies and it's made for human infants, where cow's milk, which is based on formula, is made for bovine mammals. So human milk for human babies whenever possible. It may look like you are advocating for supplementing your baby with mama's milk. When we are talking about supplementation, it does not always mean supplementing with formula. Okay, we can supplement with human milk. I want to show y'all all a brief presentation on why human milk for babies who are in NICU is important. And this is a very short.
Originally, I didn't know how I felt about breastfeeding, But once my baby came early, I felt like it was something I had to do.
Walking in here for the first time and seeing my children, nothing could have prepared me for that.
It's overwhelming, it's stressful, the dinging, the crying, pumping helped all of the background noise just kind of diminish during those times.
Breast milk truly is life-saving. When you have a baby who's born prematurely, they're not capable of eating at the breast. So the pump becomes a surrogate for that act of breastfeeding.
Some moms never had any intention to breastfeed, and they've seen how hard their babies have fought to live. They realize that this is a gift.
He was 2 pounds and 10 ounces. He's pretty much the best thing that has happened to me.
As far as a NICU environment, we can do lots of things, but I cannot recreate the human body. That bond that the mom is able to provide and the milk that she provides is crucial for their development.
I don't know if it was the smell or the taste, but you could see in their face, they just smiled and kind of perked up.
The pumps that we use know how to mimic how a preemie would suckle versus a term baby.
It's as close to breastfeeding as you can be.
Sometime I'll go back and look through his pictures from like day one. He's progressed so much from where he was at 1 pound, 4 ounces. Now he's almost 10 pounds. That definitely motivates me to pump.
Yes, my baby is in the NICU, but I'm playing such a big part of his growing and his developing. Just being able to get him that milk. It's amazing what the milk itself can do.
And I should have said at the beginning of this presentation that I don't have any disclaimers. I'm not employed by any formula or pump company. So I don't have any conflicts of interest. But I wanted to show y'all that video because it shows that human milk for human babies is the gold standard. It is full of antibodies that can never be produced by a can of formula. And again, when we're talking about needing to supplement a baby, we're asking for mother's milk first, followed by express donor milk, and then formula should always be the last option when possible. And so if you are a mom who has a baby in the NICU, your doula is a great part of your team because they're going to help you navigate that experience. And again, advocating for yourself and your baby. And if dad is around, he can also help support that mom because she's going to need a lot of emotional and mental support because it is hard having to be in NICU.
Know how I felt about breastfeeding, but once my baby came early, I felt like
okay. All right. So if you are pumping your chocolate milk, okay, pumping is a good tool when needed and when it's done correctly. You again are to measure the size of your nipple at the hospital before discharge to make sure you are pumping with the right pump flange size. Don't just open the box and assume that the pump flanges that are in the box are correct for your nipple, because often they are not. If you are pumping with the pump flange that is too small, you are negatively affecting your milk volume. If you pump with the pump flange that's too big, you are also compromising your milk supply. What you are needing to do is make you have adequate and proper size to make sure your nipple is able to freely move back and forth through that pump flange in order to properly extract the maximum amount of milk without any pain or discomfort. Most of the time you're looking to pump every 2 to 3 hours on average, depending what the needs of your baby are, but that's just a general rule. You are going to make sure you're setting your pump at that most comfortable suction level. Okay. Don't get on a pump and feel like you got to set it at a 10. Okay. You're not also trying to rush this process. Again, we're going to take our time and make sure that we're comfortable. We're also going to be hands-on when we are pumping. All right. When you're pumping, you got the pump flange. You're going to be taking your hands. You're going to be massaging your breast as the milk, the pump is doing its work, because that's going to help move that milk toward the nipple. And we're going to fill those boobs back up as soon as possible and get the maximum amount of milk out into the bottle. Please know that how much you pump is not indicative of how much milk you make. I see so many moms say, I pumped 7 ounces in 15 minutes my first week of having a baby and I'm 4 weeks postpartum and I've only gotten 2 ounces. I don't have any more milk. And then she stops breastfeeding, not realizing that no, that is normal. That just means that now that your baby's older and your body and baby are more are in sync, it just knows how much your baby's intake is and that's needed so that we're not overproducing all the time. Okay. And also pace bottle feeding, which I will go through later on, is another powerful tool to make sure that we're getting baby enough milk. Storing your breast milk, there are guidelines right here, and you can ask your care provider, and you can also use the storage guidelines on your pump, whatever pump you have. Storage guidelines and handling is going to look a little different if you have a baby that is immunocompromised. So your care provider and a NICU team, if you are pumping your milk and then transporting it to the hospital to give to your baby who's in a NICU, your care providers are going to tell you exactly what you need to do to make sure that your milk is properly stored and handled so that we're not making babies sick. Okay. But these are some basic guidelines for you right here. All right, let's move on to this next slide. And again, just knowing how big newborn tummy sizes are. So we're not getting freaked out and saying, oh my gosh, I fed my baby 9 ounces. And when my baby was 2 days old, 9 ounces and that tiny little belly, there ain't no way for that 9 ounces of milk to go into that baby's belly. Baby's belly sizes when they are born is about the size of a shooter marble. They're very, very, very small. And again, this is why milk moves in different stages of volume. So we're moving from colostrum. Then we're moving on day 3 to transitional milk. Then by week 1, we're moving into mature milk. And then by 1 month, we're well into that that mature milk stage. Everything should be smooth sailing by then. But if not, get some help. Please don't wait to get help. All right. So quick things to remember. Hand expression is important for your milk supply. It is a great tool for you to use to get extra milk out if you're needing a supplement, if you need to soften your milk, and if you just need it to know for your own reassurance, hey, I can see the milk. I know I have milk. If that helps you, do it. All right. Try to interact with your baby as much as possible. The way you're going to be doing that, put your baby skin to skin. If you have a baby sling, use a baby sling. All right. Keep your baby with you close as much as possible. And if you need to pump, especially if your baby is in a NICU, you are wanting a hospital grade pump. We are not using a Haka. We are not using a wearable hands-free pumps if your baby's in NICU. If you are choosing to exclusively pump for your baby, you are not using a wearable pump because you will not get the optimal and maximum amount of milk possible. You are wanting to use a hospital grade pump. Your wearable pumps, your hands-free pumps are designed to use on special occasions or here and there use, not as your everyday method of pumping. All right. Again, we're looking at those poopy and wet diapers. For every day old your baby is the number of poopy and wet diapers you should see. So on day 1, you should get at least 1 wet diaper and at least 1 poopy diaper. By day 5 or 6, hopefully we're looking at about 5 or 6 poopy diapers and the same amount of pee. So this is what you should be seeing. And again, you're going to also be looking for that change of color in their stools to let you know how milk transfer is going. And of course, you're going to look at their weight gain. But don't forget also mother's instinct. We know, use your instinct. The other thing that I want to show is what pace bottle feeding looks like. This is also a very quick video, and this is a way to make sure that we are not overfeeding baby and wasting.
Hi, I'm Natalie Boxall. I'm the infant feeding specialist midwife from Sherwood Forest Hospitals. I'm going to talk to you today about paced bottle feeding. So paced bottle feeding, the first step is to make sure baby is in a semi-upright position. This means that they can sit comfortably but also have nice eye contact, which is reassuring and also helps with their brain development. The second step is to let baby be in control of the bottle. Gently rub it on their top lip to elicit the rooting reflex. What they will do is then take the bottle into their mouth. The next step is to keep the bottle horizontal and just slightly bring it up. What this does is it means that baby can control the pace of the flow of milk, and that's why it's called paced feeding. When baby is having a break, instead of taking the bottle out of their mouth, leave it in their mouth and then bring it down gently. What this does is reduces air and hopefully reduces wind for baby. When they want to drink again, take that cue and gently bring it up again. Part of paced bottle feeding is that baby is in control of the feed, so we would recommend never forcing a baby to finish the feed. If they look like they want to finish, let them finish.
The reason why paced bottle feeding is so important is because we are doing a lot of different things. Believe it or not, this is one way that we are stopping childhood obesity dead in its tracks. Okay? We are teaching baby, and we're also respecting babies' natural cues, letting us know when they've had enough. Oftentimes, when we are bottle feeding a baby, let me see here. I'm going to use my bottle of glue. How do we normally feed babies? Okay, we're putting them on their back. We're laying them prone, and we are taking the bottle and we are doing just like this. And most of the time, if you done got real good at this, you done got skilled. You doing this. You're holding the bottle up like this, and you got your phone in your hand, and you're scrolling. You're having a conversation. You're not even thinking about what's happening over here. And baby is just guzzling and guzzling and guzzling and guzzling and guzzling. Next thing you know, you take baby, you burp baby, baby done thrown up everywhere. Baby's miserable. You're miserable because baby's always miserable. Next thing you know, you're taking baby to the pediatrician. You're telling pediatrician, my baby's always thrown up. Baby won't keep anything down. Oh my gosh, what's happening? And you know what the pediatrician tells you? Switch the formula. Put them on this type of formula. Blah, 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 blah. Not realizing that most often the culprit is you're overfeeding them. The reason why you're overfeeding them is because baby has no choice but to finish the bottle if the bottle is being held upright. The reason why they have no ability, why they have to do this is because it helps them breathe. In order for baby to breathe, they have to suck and swallow. All right. So when the milk is just coming, pouring down their mouth, that's all they're able to do to breathe. Okay. The other thing, and I want y'all to think about this, when we're feeding baby just like this, especially when we got our in-laws and our cousins who are not familiar with breastfeeding, they will tell you, oh my gosh, that the baby just finished that 5 ounces of breast milk super fast. They guzzled it down. They must have been hungry. You're not feeding this baby enough because I gave that baby a bottle and that baby guzzled it down. What that tells you is, oh my gosh, I haven't been feeding my baby enough. My baby's been hungry the whole time. And then what you then begin to do is supplement with formula, or feeling like you have to feed your baby constantly, 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 when it's not that at all. You're overfeeding your baby. And again, the only way for baby to breathe is by swallowing. So they have to keep on going. All right. That can then, again, send that negative and incorrect information that either breastfeeding or the breast milk is the problem. And again, a lot of times pediatricians will tell you to stop nursing, put the baby on formula, when it was never breastfeeding. That was the problem to begin with. All right. Hand expression, real quick, and I promise we're getting to the end, y'all. Hold tight. I promise. This is a great tool you want to use. This can be your lifesaver in a lot of different situations. You know, whether you're dealing with a natural disaster, if you're being separated from baby, if for some reason you left your pump at home and you're out and about and your boobs are starting to get a little full and baby just won't wake up no matter what you do, hand expression can be your friend. All right. So we're going to look at hand expression. And I'm not going to pay all 7 minutes of this video. I promise.
How to express breast milk. It's important to learn how to remove milk from your breasts. It can relieve breast fullness, soften your breasts, and make it easier for the milk to flow. Expressing your milk is also important to keep up your milk supply when you're away from your baby and make more milk when your supply is low. If you work away from home, someone else can feed your baby, or you can reserve milk for your baby in any situation. Expressing by hand is a learned skill that will improve with practice. This video will show you how to express your milk. Wash your hands well and have a clean container ready with a wide opening. First, and most important, is to start the release of your milk. To help your milk to flow, you should feel relaxed as well as connected to your baby. You can bring about a release of milk by gently massaging your breasts, seeing or hearing your baby, or even smelling your baby's blanket or clothing. The more relaxed you are, the easier your milk will flow.
I want to pause the video here.
Stimulate
If
your
you
breasts.
notice, mom is not taking her hands and moving her fingers forward and pinching the nipple. The reason for that is because at the tip of our nipple is where our nipple openings are. Okay? So if we're pinching the tip of the nipple, we're cutting off the spout where the milk is coming out. What you're wanting to do is position your hands behind the areola. When we're pushing, and the other thing you want to do is you want to push back behind the breast wall. Okay? You want to push into your chest. You're going to push backwards. What that's going to do is that's going to pull that nipple out, push those nipple pores open, and that pressure is what's going to bring that milk forward when we squeeze down. Okay? So what it looks like is, if I'm showing you from a side view, you're going to take your fingers, you're going to push back behind the areola, push back behind your chest, your areola, push back toward the chest wall, and we're going to go up and down, back, up and down, back, up and down, back, up and down, back, up and down. Notice my fingers are not moving toward the nipple. You're going to try your best to keep that hand right behind that areola. Doulas, this is a skill you should be very good at and show your moms how to use. The other reason why this is a great tool is because if you have a mom who is doubting their ability to feed their baby, if you have a mom who needs proof that she has milk, if you have a mom who is suffering from low confidence, or maybe she had a traumatic birth, one of the best things you can do to immediately boost her confidence is to show her her own milk. And hand expression, again, this is her doing hands-on. She's active in this. She's not having somebody else do this for her. She is doing this for herself and her baby. Watch that mom's confidence shoot up through the roof. All right? So this is a great skill for you to know. If you have a dad or another care provider, whoever her partner is, and if maybe mom is she's not able to hand express or whatever, you can also hand express for mom as well. Okay, I've been there as a doula, asking mom's permission. Hey, can I help you hand express? And we done got there. She might be working on one boob, I'm working on the other, and we are getting that milk out. We're taking that milk in either cup feeding baby, we are either spoon feeding baby, we are syringe feeding baby, whatever way we need to get that extra supplementation of milk in that baby to make sure that baby is gaining well, preventing hypoglycemia, preventing jaundice, or whatever you have. That is what we want to do. And hand expression is a wonderful tool to make sure that baby is getting that milk. But again, super big confidence booster. I promise you. All right. The power of her support. Her village matters. Oftentimes, the postpartum period, it can feel very, very, very lonely. You've grown that baby for 9 months. People have sat there watching. Oh my God, girl, we gonna have that baby. Da da da. You have your baby, and then all of a sudden, all the attention is put on baby, and mom is just left there in the dark. Dad is just left there in the dark. Don't nobody else exists but the baby. It can feel very lonely if mom does not have a village of support around her. One of the ways that we can also protect our mental and emotional health to prevent postpartum depression or perinatal mood disorders is making sure that we are taking an evidence-based prenatal and postpartum breastfeeding class. We are joining a support group for breastfeeding moms, or how, it can be a racial, it can be an ethnic group, it could be a community group. Anytime a mom can get around other moms to build her support network, that significantly improves her mental and emotional health. Creating a birth plan so that that mom feels that she is an active participant of her birth rather than birth happening to her. This can also help her if she is experiencing a cesarean section that she may not have wanted or whatever, or she has to have an induction or any type of adverse medical condition. Having a birth plan and having a say so on what that looks like can help empower her. Talking about her feelings with her peer support, her doula, her care provider, and speaking up for herself can help her advocate and, again, prevent a lot of the adverse emotional and physical effects of going through childbirth, including a dad. I need y'all to fully understand that men experience postpartum depression or perinatal mood disorders as well. 1 in 10 fathers suffer from perinatal mood disorders, and it's often overlooked and not talked about. Dads need a lot of support too, because they too experience childbirth and postpartum in parenthood. And mamas, please take it one day at a time. Please be patient with yourself and trust the process. And do not, I beg you, please do not compare your journey with everyone else's. Okay? Please do not compare your milk volume with how much the other mom down the street and around the corner, the mom you don't see it on TikTok, and you see that she done got 42 ounces in 1 hour, and meanwhile you got your little proud little 3 ounces. Please don't compare her with you. Everybody is different. Okay? And besides, most of those moms on TikTok that be pumping all that milk, that's not even realistic, nor is that healthy. And I can go off on a rabbit hole, but I'm not going to keep y'all too long. But please know what is normal and what is not. Okay? Comparison is the thief of joy. Don't let that happen to you. Build your support network. Get out there, get the information, and empower yourself and do what works for you, because it is your body, your baby, your birth. Knowing what the perinatal mood disorders looks like, okay? Black women, the number one killer of us in a postpartum period, it's not hemorrhaging. It's not all the other things that you might think. It is maternal mental health disorders that disproportionately kill Black women outside of cardiovascular issues or hemorrhaging that follows, okay? So knowing what's normal and what's not, and speaking up about it and not being caught up by the stigma. Please, please, please let someone know when you need help. And please know that it is okay to not be okay. When you are doing those postpartum screenings, be honest. Because if you don't speak up, nobody can help you. You are not doing yourself, your baby, or your family any favors if you are not speaking up. If you are dealing with any type of mental health issues, or if you are on medication, please communicate that to your care provider and make sure that they have the most evidence-based care of plan for you. Too often, moms are told to not take their medication because of its fear of not being compatible with breastfeeding, but most of the times it actually is safe to breastfeed while on medication. Last things, babies learn to breastfeed by breastfeeding. If we're not putting babies to the breast, they ain't gonna learn how to breastfeed, nor are you. Breastfeeding should not hurt. It might feel a little uncomfortable if you are doing this for the first time. but it should not hurt. Be patient with yourself and your baby. Remember, supply and demand. The more milk you move out, the more milk you subtract, the more your body's going to add. If we are not subtracting more milk, it ain't going to have no room to add it. Okay? Breastfed infants need to eat often. Please do not confuse this with you not having enough milk. Okay? Newborn babies are very sleepy and need extra stimulation to nurse very well. So stripping them butt naked if you have to, okay? Getting them down to the diaper, butt naked, getting a cold cloth, talking to them, singing to them, touching them, and keeping them close to the breast. When babies are close to mama, they feed better and they feed more often. Delaying the use of pacifiers and other mother substitutes, okay? I know there's a swallowers and all the noise, the gadgets out there that mimic the sound of the womb and all the rockers and all these things. But anything that is replacing mama is replacing your baby at the breast. We don't want that. We want baby feeding often and feeding well. Remember, supplementation does not automatically mean formula feeding. So you may have to advocate with your care provider at the hospital, your nurses, your pediatrician, your perinatologist. Okay. A lot of times, many of them, unfortunately, do not get a lot of breastfeeding experience and education when they are in medical school. So this is why you're in this class. This is why you're going to your prenatal and postpartum breastfeeding classes. This is why you're getting involved in a support group. And this is why you're also hiring a doula. Get a doula. I promise you, it will make all of the difference. Advocate for yourself, create a birth team, and have a birth plan. Be an active participant of your birth and not just let birth happen to you. All right? Any questions? I told y'all, we got there. I know I had only an hour. I kept y'all forever. I'm super long-winded, but I love what I do, and I want to empower you and make sure y'all have the most update and evidence-based information that is out there. I am there for you if you need to reach me at all. Follow me, call me, email me, send a bat signal. I am here to support however I can. For doulas or looking for mentorship, I am here, and I'm so happy that you stuck with me today. And that's all I got.
Well, amazingly, we didn't lose very many, Christina. Not amazingly. This was so rich.
So long-winded.
So if y'all got time, I've got time.
I got time.
So,
I'm here.
There were some questions
guys,
along
if you've
the
got
way.
questions,
Do you guys want to
drop them in the chat. I just didn't want to let you. I wasn't sure if you guys could see the count. So go ahead, Kelly, take over. But
Well, I was going to say there were some questions throughout the chat, and someone had mentioned, I think Zasia, she mentioned that it's been about 5 weeks since, and she still hasn't been able to get her supply back, unfortunately.
Okay. Zaisha, I think this is Zaisha, my local mama. Let's talk. Let's sit down. Let's explore what's happening. Oftentimes, we can easily try to boost that milk supply back up. And so it's a case-to-case basis, just depending on what may have happened. So I would love to get a good history on what happened and when you started noticing a dip in supply, and we can take it from there. So just reach out to me. We can go from there.
And then look in the Q&A. I answered most of the questions in the chat, Kelly.
Okay.
But look in the Q&A. There were a couple of questions about the unswaddling thing, Christina.
Yep, I remember that.
If you could go back to that one. There were a couple around that.
So I'll just speak openly about swaddling. Again, when babies are swaddled, what that is designed for is to mimic the womb. Okay. When babies are swaddled, they're calm. They often go into a deep sleep. They are like chilling. Okay. The reason why that it should be either done with caution or if not at all is because when babies are out of the womb, we want that baby stimulated and awake and asking to nurse as much as possible. And when babies are swaddled, they are not using their hands. They are not using a lot of their sensory muscles and movement. Babies in any mammal, if you notice, even with kittens and dogs, right? When they are nursing on their mama, you'll often see the puppies and kitties clawing at the mom. They call them making biscuits. Human babies do the same thing. You'll see them touching their face and pounding on the mom's boob and grabbing the nipple. That is the same thing. That same stimulation is what triggers the oxytocin flow and stimulating the mom's letdown. The letdown is usually that tingling or pulling sensation that a mom feels as her milk is starting to flow from the milk ducts out into the nipple. And also, baby's hands, it's what helps them find the breast. And especially if we have a mom who may have flat and inverted nipples, think about it. When we take off our bra from a long day, our breasts have been compressed, right? Our nipples are flat. But anytime cold hits our breast, or if our hand, or if our fingertips or arms rub up against our boobs, any type of stimulation, that nipple will start to invert. It's the same thing with the baby touching mom's breast. We are wanting that nipple to come out so that baby can find the nipple easily and latch on to the boob. Okay. Babies also have very limited eyesight when they're born. Their eyesight is usually from the distance of the crook of your arm or the level of your boob up to your eyes. All right. So in order for babies to help guide them to the breast, they use their hands and feel the nipples, and they'll take their hand, put it to their nose and taste the hand. And again, don't forget, those Montgomery glands are producing that oil, okay? And they're using that and touching their mouth and rubbing it on their face to help them find the nipple. So this all gets severely limited when babies are swaddled. And the longer baby sleeps, that usually means baby is not being put to the breast as often as they would if they were able to move freely and get to the breast on their own. Hopefully that answers your question.
There was one question, and it correlates with mental health also. And I think the question I had here was, when breast pain or latch trouble starts triggering anxiety, how can a mother separate her physical healing from the mental health toll? And what are some early signs of feed-related stress that is becoming too much?
Yes. Pain is a powerful signal and a teacher. All right. So if you are getting ready to feed your baby, and if you find yourself like trying to delay your feeding or say, okay, I'm going to go fold that extra towel, that napkin over there, or I'm going to go vacuum. And if you're getting ready to nurse your baby, and if you're like getting anxious, if you're feeling resentful to your baby because you know you're about to start hurting, if you find yourself tensing up and rolling your toes, something is terribly wrong. Okay, this is where we need to get a skilled lactation professional to come in and look at what's happening to make sure that your latch is optimized. All right. If we are at the point where we've had, if it's gone on too long, we have nipple damage and we are not able to put our baby to the breast, and you're sitting there feeling like, well, and I hope I'm answering this question correctly. And if you feel like, well, dang, I'm not able to put my baby to the breast, I'm not a good mom, or I'm not doing what I'm supposed to do, I suck or whatever, this is again where trusty hand expression can come in. All right. The number one rule we want is to feed the baby. So if it looks like we are hand expressing, if we are pumping, if we're doing whatever, even if it means that this boob is out of commission, but this boob is a little bit better if we can latch this baby on this side, and until that nipple heals on that side and we're hand expressing, that's what we gonna do. Because we need to make sure that this baby is latched on and gaining weight and is healthy. All right. So try not to take that as a failure. We just had some technical difficulties, but the way you're going to prevent that is by not letting that problem go on too long and get skilled help a lot sooner. I do want to point out one thing. There is a condition that is called dysmorphic milk reflex. Some moms can feel depression or anger or sadness when they latch their baby on and get their letdown. That has been documented. And usually, as the feeding goes on, it'll start to dissipate. All right. If you are feeling those symptoms, and if that is getting worse, progressively worse, if you start having negative feelings toward your baby, if you start having negative feelings for yourself, if you're crying, if you're not getting out of bed, if you're not taking care of yourself, if you're having hallucinations or worsening thoughts, thoughts about harming yourself or your baby, that means we probably got something a little bit more sinister going on, and we need to get to a skilled mental health professional to make sure that we're not going further down that path toward different scopes of postpartum mood disorders.
Okay.
Hopefully I answered that question correctly.
Yeah, that was excellent. Christina, did you have any final thoughts for us before
I know
turn
I
it
gave y'all a lot. I know I gave y'all a lot. Y'all probably like, dang girl, we was just trying to get the basics. But look, if it's anything with Christina Renee cheek on it, I do it. If I'm gonna do it, I'm gonna do it all the way.
Do it
I
thoroughly.
do I do it very thoroughly. I do mentorship. So if you're looking to have a mentor, please reach out to me. I will do my best to accommodate. Let's see here. If
There
you are
was a
looking to
question, if we could, I think this is a good one. Girls with hormonal issues like PCOS have trouble with breastfeeding after giving birth?
Yes, that is very common, and that is something that you want to disclose with your care provider early on so that they can have a plan of care for you. And also, it is not too soon to start meeting with the lactation counselor or what a mom with PCOS is going to want to see or see prenatally, or a mom who has really severe thyroid issues. Meeting with a board certified lactation consultant, not a WIC peer counselor, not a certified breastfeeding specialist. You're wanting to get the big dogs in. You're wanting to see an IBCLC, an internationally board certified lactation consultant, making sure your hormonal levels are where they need to be. Also, that consultant can get you on a path of care and let you know what a realistic path and expectations are potentially for your milk volume. That also ties into if you have had any type of breast surgery, if you've had a reduction or an augmentation. Anytime we are altering the breast and skin, if we are taking out milk ducts or fat or tissue or whatever, if we are removing the nipple, if we are relocating the nipple, that can affect the amount of milk that you are able to produce. And that might mean you may not be able to exclusively breastfeed. So the worst thing you can do is not have that conversation, and then you get in there thinking you're going to be able to fully breastfeed and baby ain't gaining weight, not knowing that the issue was always that. So just make sure you're having those conversations early on with your care provider.
Okay,
And
we've got to
getting
get
the
these
right
last ones
type of
in.
consultant to help you. Yeah.
We've got to get these last questions in because there's some good ones real quickly. I
Of
know you
course.
said you prefer not to swaddle the baby when they're nursing, but is it okay to swaddle them when they're sleeping? So they'll sleep
Yeah,
during
I
their
mean,
sleep time.
I say that every mom should do what works best for them. I just say anything in moderation. I'm not going to just say never use a pacifier, never use a swaddle. Everything in moderation, especially when we are trying to, when we're trying to, I don't want to say mask a newborn's normal biological behavior. Okay. Because again, we are wanting newborns to feed often. We are wanting them to nurse well. We are wanting them to communicate to mom when they're hungry. Okay. So anytime again, we're constricting the body, or if we are supplementing the baby with the pacifier, when baby is suckling a pacifier on a consistent basis, oftentimes that is replacing a feeding. And then because of that feeding being replaced, that is also negatively affecting your milk supply. Without nerding out on y'all, there's a hormone that is produced in babies when they are suckling, much like how you feel less hungry when you're chewing gum. It's the same thing that baby receives when they're suckling on a pacifier. that same hormone is telling babies that they're full, and therefore they're not
Mm.
nursing at the breast. Versus if we're not using those tools, baby is going to be, asking to nurse more often. So I just say use things in moderation. But of course, I'm always going to tell mom, you need to do what's best for you. And just, having the facts and making the decision that works best for you and your baby.
Okay, one last one, maybe two
Of
more,
course.
real fast, because Sophia,
I
I
got
think this is a
time. I got plenty
brilliant
of time,
question.
y'all.
Okay.
I got plenty of time.
Sophia's question is, they're doing the golden hour and she has family
Uh-huh.
internationally. Should she delay calling them during her, or should she delay, having her partner make those calls during the golden hour?
Oh no. I say do all the calls and all the things. That's great. If we're showing mom on video, all the things, that's good. What I'm simply saying is I from a doula, and also just, having a room full of people and spectators, and even, nurses in and out of your room, people asking you
Mhm.
questions and taking phone calls, and you feeling like, you're having to stratify your attention. It can really take away from your focus of being
On that.
mentally and emotionally present in the moment, because it's,
Mhm.
your hormones are doing a lot of things immediately after you having your baby. Okay, your oxytocin levels are through the roof, the highest they will ever be once your baby leaves your womb. We are trying to sustain that oxytocin flow as long as we can, because that's where that delivery, attachment, and bonding comes in. And that's when that optimal milk transfer comes in. So we are just trying to make sure that mom and baby are protected. We are also trying to reduce the level of pathogens and potential things that can make babies sick. The more we're passing baby along and all these things,
Mhm.
we're trying to basically create a bubble. Let me just also say that this is also why, going toward the colder months, babies and moms are usually more immunocompromised. And we have these really, really risky viruses like RSV and the flu and COVID coming along. So these are things that you want to be mindful, and also just controlling your space and making sure your breastfeeding is going well before you're, entertaining a lot of people and things like that.
Mhm. Oh, I love that.
If that makes
And back
sense.
to the golden
Yeah.
hour, protecting that time. If your partner wants to call and grandma and them, Nana and them, whatever, can quietly just be in that moment with you, saying a
Yeah.
prayer, um,
Yes.
uh, blessing over you, and you can just have that time. I mean, that's the first time that baby is earthside. It should
Yes.
be magical or special, and they're, and if that's the if that's what's involved. I know for a lot of families, mama wants to say that prayer, right? And
Yeah.
have that. And then it's also important to protect it with the care team, because back to the gestational diabetes piece, do try to join Dr. Henderson on Thursday, because I have seen so many times where it's interrupted because they're wanting to
Mhm.
test the baby for, particularly if you have gestational diabetes. Though they want to test the baby for hypoglycemia, and rightly so. But if you, and we'll talk about, as Christina mentioned, if you can express your colostrum beforehand, freeze it. I dropped the answer in the chat. We'll include some of this in our with the recording. Freeze it, take it with you. You can give your baby the colostrum. Do not let them give your baby the formula, because
Or
the
sugar water.
baby's blood sugar will spike and then it'll crash, and then they're taking it off to the NICU, and then you got to fight to get baby girl back and all that other good
Yeah.
stuff.
Yes,
So
one
yeah,
intervention usually cascades into another one, and another one, and another one. And think about what that's doing to your mental and emotional health, right?
right.
And let me just say, I'm not saying don't have any visitors, y'all. Like, I'm just
Yeah.
saying protect your birth space. Be very intentional about who is in the room, who is in your circle, who comes and visits. The last thing you want to do is be home with a sore bottom, right? Or recovering from a cesarean section. You got a newborn, your boobs are super sore, and you got 5 people wanting to come and keep you awake. And nobody's cooking for you. Nobody's asking you what you need. Nobody's bringing you a meal. And you're doing all of these things. And when we're doing all these things, that usually means that something is falling behind. And oftentimes that means mama's not taking care of herself, baby's not being fed, and everything. And this is where, again, having a birth plan comes in place. Have a course of plan and action and ready to go. Make sure everybody's on the same page. If you are a mom and you are expecting, if you have older siblings, have somebody get the older sibling together so that mom is not having to, worry about all that. The less amount of stress you can do, that's what we're wanting to do. And I know that there are, cultural expectations too. I know in some cultures it is a family event. So I'm not, I want to make it clear that I'm not like shooting that down, but I just say, just be very intentional about what your birth space and your postpartum space and your emotional and know your capacity, y'all. Please don't feel like you have to say yes to everything, because that is one of the quickest ways for postpartum depression. And we have it bad, y'all, because let's be honest. Let's keep it a buck. We are often being told that we got to do this, that, and the other. I can do this and cook a meal, take care of my husband, take the kids to school, run dry cleaner, all this. And we're supposed to do it without a sweat. And we suffer the burdens the most. And it's killing Black women, y'all. Please don't take this for granted. Take your rest. Take your rest. Take your rest. Heal and take your time.
Amen.
Please.
And thank you, Christina. Thank you. And y'all can blame Christina. Say that girl, Christina, I forget her last name. So they can't find her.
Yes, y'all. Postpartum parenting is killing us, y'all. We're suffering from preeclampsia. Preeclampsia is usually due to high blood pressure and stress. We're doing too much. We're dying from postpartum hemorrhaging, y'all, because we're not in bed and healing the way we should.
Oh my gosh.
Nobody's telling us this. And we're dying. And these deaths, over 80% of maternal deaths are preventable. And we need to know the signs and honor our capacities and know how to say no. Please learn how to just say no, not yet, I can't. And please say, I need help. It's okay
to need help and not be okay. I know you can't see the chat necessarily, Christina, but Trisha, you just gave me goosebumps. It says, thank you, Birthing the Magic Collaborative, for hosting this most informative webinar tonight. Our presenter, Ms. Cheek, tonight was passionate and well-versed in educating our diverse audience. Birthing the Magic Collaborative has been instrumental in me furthering seeking how I can become more educating and opportunities to be a resource to my community and help reduce Black maternal disparities. I'm more excited about becoming a doula. She's just becoming a doula. And knowing that these resources are made available to stay in tune with our mamas. Keep up the great work. And I'm in full support of this organization and wish much success. That, I think, is what we can close on that one. And guys, don't forget again to
please reach out, ladies. If y'all have any questions, if you need any help, I'm here.
She's got our information here. We'll drop it we'll send you to the recording. One last quick question. One last one.
Of course.
Because we have to ask this one. Mamas who have had breast implants, are they able to nurse?
They can. They definitely can. However, I will say this. This is where you want to have a conversation and with your surgeon beforehand, knowing their method that they're going to do the implant. Okay. If they are going behind the breast wall versus, or if they're putting the implant on top, if they are removing any tissue, again, if we're moving the nipple, if we're removing the nipple and putting the nipple back on, anytime we're cutting into the the milk glands or anything like that can severely compromise your milk supply. So just knowing the type and method they're going to use to do the surgery, have that beforehand in your consultation, and just letting them know, hey, I do want to have an augmentation or a reduction, but I do want to have a baby in the near future and I plan to breastfeed. What is the best course of action for me to make that successful? And what can I expect if I do this form of surgery versus that?
Mm.
And also, if you
Well,
need, get a lactation consultant, get a doula on board, have that consultation not only with the surgeon, but also someone experienced in lactation beforehand so you know what to ask.
thank you. Oh,
Sure.
and a reminder again, to get your credit hours, I took it was about 15 minutes after the hour. I took a screenshot. There were about 60 some odd people still here.
Sorry, I kept y'all all
And
night.
I will send those names. No. I'll send those names to Nakia and say, these people should get 2 hours, and then anyone else will get an hour. And you send the email to hello@birthingmagic.org. And I dropped it in the
Yes.
chat. And so make sure you give your full name in the email, as well as whatever your name is. Like someone is birth architect, make sure you give us that name in your email, because that's what the team will be looking for to give you your 2 hours. In case your obviously your name is not birth architect. So your certificate will be in your given name, your legal name, but then make sure we know that she can match it to what was in what's going to be on our screen. So some of these, like this iPhone to host, this person that just said, that's great at 627, you're going to have to say who you were at iPhone. You're a purple iPhone, but tell me real fast right now who you are.
Get them credits, y'all. Get that education, ladies.
There's a quick iPhone
and
right
once
there.
you
Tell
get
me
your
who you are.
certification,
Yeah, we want to make
please
sure we
keep
catch
up with
that
your
one. I thought I
certifications,
caught
y'all.
everybody that had a real name. I think you may be the only one that doesn't have a real name. But anyway, well, thank you guys so much. Christina, my gosh, wonderful. Thank you so much.
It is my absolute honor and pleasure. Please reach out. I'm here for y'all. Pour into one another. Listen to your bodies. Honor your capacity. And let's get out here and save these mamas. If you are a birth worker, you are doing the Lord's work. You are needed. You are valuable. And you are a critical part of solving the maternal health crisis here in the country. Please continue forward in the work that you do.
And for our mamas who watch this in recording, Christina does provide virtual consultations for moms. So you have her information here, and then we will have her on our website as a resource for you. And thank you, Kelly, as usual, for being our co-conspirator. And we'll see you all tomorrow night. We have 2 workshops. The first is around supporting the mama in the NICU, or the mom who's had a preemie baby. So do join Dr. Kay Wilson, who is a neonatologist, and our CEO, Valencia Walker, 2 neos who are going to talk to you or share with you. You will get a contact hour for this as well, helping mamas support their baby in the NICU. Christina touched on it very briefly about the critical importance of mamas who have babies with premature babies, and why we really, 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 really want those moms to get, or those babies to get mother's own milk. Donor milk, no indictment of donor milk, but it is not the same as mother's own milk. And certainly we want to avoid the use of human milk, bovine milk as much as possible. So if mom does nothing else, we would really love for her to be able to provide her own milk while she's in the NICU, and we know it's a challenge. I shared with you some research that got very little noise when, and she was actually from Macon. This nurse did, this is probably 25 years ago now. It got very little attention when she published her research, but what she did was she gave mamas, this tells you how old it was. What were those little, not iPod, those little things that you could listen to music from? Apple, the little Apple thing originally, you downloaded music to it. It was called a iPod, right? Yeah, yeah. You downloaded, she had you download music to it, whatever music you wanted. And then she had the moms look at pictures. This is how old it was. She took Polaroid pictures of the baby, their little hands and their little feet and their little, but not with all the tubes and scary things. And she had the women sit in different parts of the NICU unit and listen to the music and look at the pictures of their babies. And then they would measure how much milk the mamas were able to produce and the nutritional value. And those mamas who looked at the pictures and listened to the music actually got more milk, and the nutritional value was better. And I have tried to get Barbara to come out of retirement. She was 10 years older than me, just to talk about her research. And she's like, you do a better job talking about it than I do. So I'm telling y'all, talk to your mamas about it, and encourage them if they're, and I think it would work with term moms too, when they're at work. And I think of all the ways we can listen to music now, so they don't even have to have an iPod or whatever that thing was. But things that they can do to relax. But thank you, Christina. Thank you, Kelly. You guys have a great night. We will
Very
send you a
welcome.
link for the sessions tomorrow, the 2 sessions tomorrow. The second one, so we have the first one, helping Mama Thrive if she has a NICU baby. And then the second one tomorrow night is, bear with me a quick second. It is, my computer went to sleep, but we'll send you links for both of them, and we hope you will join us, and good night.
Good night, everyone.